We are taking the plunge, both literally and scientifically, into a topic that's become almost, almost synonymous with peak athleticism. We're talking about the ice bath, or what researchers more formally call cold water immersion, CWI.
It's such a powerful image, isn't it? I mean, if you follow any high-intensity sport, any team sport,
Yeah, you see it everywhere.
college football, basketball, soccer, hockey, even Olympic-level competition, you see these athletes totally exhausted, and they're just subjecting themselves to these frigid temperatures.
Submerged right up to their chest or their shoulders. It's almost become this accepted ritual of recovery.
It absolutely has.
And for years, CWI has been seen as this ultimate, non-negotiable fix for post-workout soreness and inflammation. But the sources we looked at for this deep dive suggest something a bit different.
A lot more nuanced.
Exactly. While it is incredibly effective in one area, its application needs, a lot more thought than just ice it down.
Right.
Our mission today is to move past those common assumptions. We're going to dig into the specific research that tells us when CWI works, why it works, based on some very exact temperature and time protocols, and this is the crucial part, when this powerful immediate fix might actually be working against your long-term physical goals.
And that's where we get to what we need to pull apart today, this critical trade-off. We're calling it the recovery paradox.
A recovery paradox. I like that.
Because CWI is, and let's be clear, it's undeniably effective for quick subjective recovery. It makes you feel better right now. It minimizes that immediate soreness.
Okay.
However, the evidence is getting clearer and clearer that there is a significant potential trade-off for athletes who are primarily focused on maximizing long-term strength and, muscle growth.
So you're saying you're essentially choosing between feeling good today and getting stronger tomorrow.
That's the core conflict. It's a choice.
That is a fascinating conflict. Because in the world of elite athletics, especially during a compressed season or a tournament,
Oh, yeah.
feeling good today often is the #1 priority.
It's the only priority.
Okay, so let's unpack this paradox. I think the best place to start is where the athletes start, with the immediate, undeniable benefits that have made CWI such a fixture in these high-performance environments. So the primary reason that CWI is just so ubiquitous, so common, it isn't because of some complex long-term physiological advantage. It's because it delivers these really reliable short-term wins.
Right. And those wins are absolutely vital for athletes who are operating in these high-intensity, quick turnaround schedules.
Like a soccer player who plays on a Sunday and then again on a Wednesday.
That's the perfect example. You need rapid recovery, period. There's no other option.
You can't be thinking about long-term adaptation when you have another game in 72 hours.
Not at all. And that's the key context. The sources we looked at confirm that CWI has become a staple recovery strategy for exactly that reason. It's the belief among coaches and the practitioners that it just successfully speeds up the recovery process.
So this widespread adoption is really just an adaptation to the demands of modern sports. The schedules are brutal.
Absolutely. They often prioritize being ready for the next session, the next game, over, the absolute optimization of every single long-term biological adaptation. It's a practical choice.
And when we look at the actual measurable outcomes, the most consistently reported benefit, the one that really justifies all the, the investment and the discomfort, is targeting delayed onset muscle soreness.
DOMS, yeah.
Tell us how the sources quantify that. I mean, how much of a reduction are we really talking about?
It's significant. CWI is widely recognized for its efficacy here, and this has been consistently quantified in meta-analyses and systematic reviews that compare CWI to just, passive rest or doing nothing.
And the finding is pretty robust.
It's very robust. CWI has been shown to reduce muscle soreness for up to a pretty significant window of 96 hours post-exercise.
96 hours. So that's 4 full days.
4 days.
4 full days of documented relief from muscle soreness just by putting yourself through a short blast of cold water. I mean, that is a massive advantage in a demanding season. And I think the clinical reviews even narrow that down, right? They talk about the subjective feeling of relief.
They do. They highlight that immersion used immediately after exercise specifically improves what they call perceived recovery, and it reduces soreness most significantly within the first 24 hours.
And that idea of perceived recovery, I have to imagine that's just as important as any biochemical change for a professional athlete.
It's arguably more important.
Really?
Think about it. If an athlete feels less sore, they are much more psychologically and physically willing to engage fully in the next training session or the next game.
They're not dreading it.
Exactly. This neurological dampening, which, we'll get into the details of in a bit, it makes a huge difference in just adhering to a demanding schedule and your overall readiness. A player might still have that micro damage in the muscle, but if the pain signal is muted,
Then their performance compliance goes way up.
it goes way up.
Okay, so CWI works right away by making the athlete feel less like they've, been hit by a truck.
Mhm.
But we also have evidence that it's doing more than just masking the pain.
Right.
It's actually accelerating recovery by reducing specific biochemical markers that are associated with damage.
Yeah.
And this brings us to a really key indicator, creatine kinase.
Creatine kinase, or CK.
Yeah.
Yeah, this is essential to understand because its levels in the blood are used as a reliable, if indirect, proxy for how severe muscle damage and stiffness are.
Foxy.
CK is what's called a cytosolic enzyme, which just means it lives inside the muscle cell. When your muscle fibers undergo significant strain and they get these micro tears, the integrity of the muscle cell membrane, it's called the sarcolemma, is compromised.
And the CK leaks out.
And the CK leaks out into the bloodstream.
So if we think of a muscle as a building, CK is like the debris we measure when the building's walls have been damaged.
That's a great analogy.
So higher CK in the blood means a greater degree of that cellular damage.
Precisely. And the sources confirm that these carefully controlled immersion protocols, they've been shown to produce notable and pretty rapid decreases in the circulating CK levels.
Which suggests CWI is actively mitigating the cellular impact of that intense damaging exercise.
It's not just numbing the pain, it seems to be accelerating the clearance, or at the very least, reducing the measurable signs of muscle breakdown right after you exercise.
But I have to ask the obvious question here. If the damage is what's necessary for adaptation for growth, is there a risk in suppressing CK too quickly? Are we just, sweeping that debris under the rug before the construction crew has seen it?
That is the essential question, and that's what we're going to grapple with later in the paradox section. But for now, just in the immediate recovery context, getting those high CK levels down quickly is seen as a positive.
Because high levels mean more soreness for longer.
Exactly. High, prolonged CK levels correlate with extended soreness and stiffness. So by producing this notable decrease, CWI allows the athlete to return to a baseline state faster.
And that measurable effect, the reduction in these stress markers, combined with a subjective feeling of less soreness.
It all drives toward the ultimate goal in competitive sports, which is performance maintenance.
And performance maintenance is just the ability to perform at your max, day after day, regardless of the physical load you just went through.
That's it. We see evidence that suggests CWI improves recovery indicators like muscle power and these subjective recovery scores after high-intensity training.
So give us a concrete example.
Okay, imagine a basketball player who relies on their vertical explosiveness, or a sprinter who needs to repeatedly generate max speed. If CWI allows them to recover that critical muscle power output within, say, 24 hours instead of 48 hours, they can maintain their peak performance throughout a really demanding playoff schedule.
It buys them competitive time.
It buys them time. This immediate functional recovery is the whole reason CWI is so widely used in competitive environments, even with those long-term trade-offs we're going to talk about.
So just to summarize the utility of CWI so far, it's a high-impact short-term intervention. It delivers rapid, quantifiable relief from soreness for up to 96 hours.
Right.
It vastly improves how recovered you feel within that first day, and it measurably lowers the biochemical signs of muscle damage, like creatine kinase. It's a superb tool for managing that immediate physical stress.
It absolutely is. So to really understand this recovery paradox, why CWI is so effective now but could be problematic later, we have to pivot from just the observed effects to the underlying biological processes.
Okay, let's get into the mechanics.
Because the benefits aren't just random. They're driven by three distinct and really powerful physiological shifts that are all happening at once. They address the physical damage, the inflammatory response, and that subjective feeling of pain.
So a triple threat, basically. Let's start with the first one. What's the body's first, involuntary response when that icy water hits your skin, and how does that help with recovery?
Okay, the first and most pronounced mechanism is vasoconstriction.
Narrowing of the blood vessels.
Exactly. It's the immediate involuntary narrowing of the peripheral blood vessels, especially in the limbs that you've submerged. It's the body's primal attempt to conserve core temperature.
We've all heard of this, but how does narrowing the blood vessels actually help a damaged muscle? I mean, intuitively, wouldn't the muscle need fresh blood and nutrients to heal?
That's a great question, and in the long run, yes. But in the immediate aftermath of damaging exercise, the problem isn't usually a lack of nutrients, it's a problem of fluid dynamics.
Fluid dynamics. Okay.
When muscle fibers tear, fluid just rushes into that damaged area. This causes edema, or what we call swelling,
Mm-hmm.
and that swelling increases pressure on the local tissues and the nerve endings, and that's a big part of the pain you feel.
So vasoconstriction is like a dam.
In a way, yes, it reduces the blood flow to the area, which critically reduces what's called the hydrostatic pressure inside the capillaries. This process is thought to directly reduce swelling and minimize the extrusion of fluid from tissues that naturally happens after exercise.
So it's almost like a localized, intense form of compression, just from the inside out. It's limiting the space available for that fluid to build up.
That's a perfect way to put it.
So less swelling means less physical pressure, which translates to faster immediate mobility and less pain. That's a clear, short-term win.
Okay, what's the second mechanism? This one is often discussed right alongside inflammation.
That would be the reduced metabolic activity, or you can think of it as cellular slowing.
Cellular slowing.
The cold exposure significantly decreases the metabolic rate of the tissues that are being chilled. We're talking about basic enzymatic reactions, oxygen consumption, everything just slows down.
But why is slowing down metabolism a good thing, especially if the goal is repair? Shouldn't we want to speed up cellular processes to fix the damage?
And you've just hit the nail on the head of the paradox again. But in the immediate short term, slowing these processes down is an effective strategy. And that's because it helps to slow the initial inflammatory responses that follow muscle exertion.
So inflammation is the target. Right. Inflammation is a necessary process. We need it. But if it spikes too high and too fast, it can actually contribute to secondary damage and significant stiffness. So by chilling the tissues, you are temporarily damping down that initial chaotic fire of inflammation. You're limiting the rapid cascade of inflammatory molecules.
So it's like a temporary cap on the chaos.
Yeah.
It's designed to prevent an overreaction in those first few hours.
Yeah.
Okay, so we've managed the physical swell with vasoconstriction, and we've put the brakes on the chemical fire with metabolic slowing.
Right.
But the most immediate benefit athletes talk about is that sudden feeling of relief. That's got to be purely neurological.
It is. And that brings us to the third crucial mechanism, the profound neurological effects. CWI directly impacts the nervous system. It first stimulates and then essentially dampens pain signals.
How does it do that?
The intense cold overloads the sensory nerves, specifically these rapidly conducting fibers called A-delta fibers. And it effectively scrambles the transmission of pain signals from the muscle site up to the spinal cord and then to the brain.
So it's like a localized sensory override. The
Yeah.
signal gets garbled.
Precisely.
This is why the improvement in that perceived recovery is so fast and so consistent. You don't feel better because the muscle is immediately healed.
No.
You feel better because the message of pain is being actively suppressed.
That's correct. The cold temporarily decreases nerve conduction velocity. It's the instant gratification component of the cold plunge. And this neurological shift is the key to reducing that subjective sensation of soreness. It lets the athlete feel functional, even if the deep repair processes haven't even really started yet.
So these three mechanisms, constricting vessels, slowing metabolism, dampening pain, they work together brilliantly to manage the immediate, acute symptoms of exercise-induced damage. But you mentioned a caution earlier, the translation challenge.
Mm-hmm.
How reliable are these mechanisms when you apply them to a whole human body, not just a muscle in a lab?
That's the subtlety the sources really highlight. While the effects are definitely observable, the physiological mechanisms aren't yet universally quantified, and their systemic effects can be, well, inconsistent.
So what works on a single muscle in an animal study might not scale up perfectly.
Exactly. The research limitation is that the powerful anti-inflammatory effects that are observed in, say, localized single muscle studies, they don't always translate directly or reliably to whole body immersion in humans.
Wait, hold on. Why is chilling your entire torso different from just chilling your leg? What's the difference?
When you chill a small localized area, you get a very intense, very focused response. But when an athlete submerges their entire body, the systemic homeostatic mechanisms, the body's core survival systems, they kick in fiercely.
The body goes into self-preservation mode.
It's trying to protect the core temperature. And that leads to all these internal shifts in blood flow distribution and systemic hormonal responses that just complicate that localized, purely anti-inflammatory effect. We can't just assume that the isolated benefits will hold true when you apply it systemically.
That adds a whole new layer of complexity. So, to revisit that analogy you used, if the physiological effects of CWI are like hitting the pause button on a construction site to stop the initial chaos.
Yeah, the swelling and the cellular mess.
We have to make sure we don't accidentally pause the entire system. Is that right?
Precisely. Vasoconstriction and metabolic slowing, they stop that immediate rush of chaos. They prevent further secondary damage from runaway inflammation. But the danger lies in mistaking that temporary pause for a completed repair job.
So you stop the mess, but you also stop the cleanup crew from getting the signal to even show up.
That's it. If the entire process is paused, especially that initial inflammation that signals the repair crew, then the necessary foundational work for the stronger, larger structure can't be executed. You're interrupting the signal for long-term growth. This construction site, it needs a little bit of chaos for a brief period so the foreman can figure out what materials are needed for the upgrade.
That distinction between stopping the chaos and stopping the necessary repair signal, that is absolutely critical. And it sets us up perfectly to talk about how we manage that pause button effectively.
And because the benefits of CWI are so reliant on these transient physiological mechanisms, the results are fundamentally highly protocol dependent.
Meaning you have to do it right or it doesn't work.
Or it might even backfire. It means that if you're using CWI, whether you're an elite athlete or, a dedicated amateur, you need to discard these generalized practices, just sit in cold water, and adhere strictly to the research-backed numbers.
The specifics matter.
They're everything. In CWI, approximation leads to inconsistent results and, potentially negative outcomes.
Okay, this is where we need to get specific. If you're listening and you use ice baths in your routine, this is the part to really pay attention to. Let's start with timing. When is the absolute peak moment to step into the cold?
For maximum benefit, specifically for achieving that reduction in BOMs and the best subjective recovery, the immersion has to occur immediately after intense exercise, or as shortly after exertion as you possibly can.
Why so fast?
The goal is to interrupt those initial inflammatory and swelling processes right at the point where they begin to escalate. And that's usually within the first 30 minutes or so post-activity.
So don't wait an hour thinking you'll cool down first or something.
No, get in immediately to achieve that maximum vasoconstriction and metabolic slowing.
Okay, next up. Duration. How long should you be in there? We've heard all these myths of athletes doing 30, even 40-minute immersions. The sources suggest shorter is actually far sweeter.
Absolutely. The research is very clear on this. The benefits are tied to short, controlled exposure. Your immersion should last under 15 minutes.
Under 15.
And studies even suggest a specific medium duration of about 10-15 minutes is the most effective for measurably decreasing those biochemical markers of muscle damage we talked about, like creatine kinase.
So why is 15 minutes the critical cap? Why don't we see added benefits at, say, 20 or 25 minutes? Is it just diminishing returns?
It's diminishing returns and increasing risk. When you sustain the cold beyond that threshold, the risks really start to outweigh the rewards. Durations longer than 15 minutes may not provide any additional physiological benefits for recovery, but they do increase the likelihood of over-suppressing those necessary adaptive pathways we've been hinting at.
So you're just intensifying the pause signal without getting any more pain reduction.
You got it. It just becomes unnecessarily prolonged exposure to cold stress.
That is a key piece of information for the listener. More discomfort does not equal more gain here. Okay, now for temperature, which is also the most variable component in practice, what's the optimal range for the effect without crossing into just hazardous cold?
The water temperature is absolutely critical. It should be cold enough to induce the necessary physiological changes, which generally means below approximately 59 degrees Celsius or 15 degrees.
But there's a sweet spot, right?
There is. The sources pinpoint a more precise optimal range for consistent results. 11 to 15 degrees Celsius, which converts roughly to 52 to 59 degrees Fahrenheit.
Okay, 52 to 59.
And this range is specifically shown to produce those notable decreases in muscle stiffness and damage markers very efficiently.
That is decidedly cold. I mean, it's definitely a shock to the system, but it's not the near freezing point that some people might imagine when they hear ice bath.
Exactly. And the sources offer a critical caveat here. Very cold temperatures, say, 4 or 5 degrees C, which is down in the high 30s Fahrenheit, they do not necessarily provide additional physiological benefits in recovery and adaptation metrics compared to that moderate cold range we specified.
So colder isn't better.
Moderate cold is preferable for consistent results. It achieves the vasoconstriction and the metabolic slowing you need without introducing unnecessary thermal stress risks or just prolonged awful discomfort. It's about efficacy, not about theatrical freezing.
It really sounds like the key to CWI is understanding that it's a precision intervention. You can't just dump a bag of ice into a tub and hope for the best.
No.
You have to meter the time and the temperature precisely to get that desired short-term hit of relief without overshooting and causing other problems.
And that's why we use the analogy. Following an optimal protocol for CWI is exactly like steeping a cup of tea.
Okay, explain that.
Well, you have to find the precise balance of time and temperature to extract the desired benefit, the maximum flavor, or in this case, the maximum short-term recovery,
Without ruining it.
without ruining the flavor of your long-term training progress. If the water is too warm, you get nothing. If you leave the tea bag in too long, over 15 minutes, the tea becomes bitter, which physiologically means blunting those long-term adaptations.
So the science dictates a very specific, targeted intervention, applied immediately, lasting 10 to 15 minutes, in water calibrated between 52 and 59 degrees Fahrenheit. Anything outside of that window risks, what, suboptimal result, or worse, running directly into this recovery paradox.
That's exactly right.
Okay, so we've established that CWI is a powerhouse tool for immediate relief, for pain suppression, for rapid turnaround. But now we have to dive into the cold truth, the dark side.
Yeah.
This is the central finding of our deep dive. When an athlete's goal shifts away from quick performance maintenance and toward long-term physical development, the cold plunge becomes a significant risk.
This is the most critical conversation for anyone who lifts weights, trains for hypertrophy, or is just focused on maximizing their strength gains over a period of months or even years.
Because the very thing that gives you the immediate relief is what causes the long-term problem.
The mechanism of immediate relief, that metabolic slowdown and the inflammation suppression, is the exact mechanism of long-term interference.
Okay, let's define this conflict as clearly as we can. What exactly is happening at a molecular level that blunts that development?
Repeated cold immersion may severely blunt long-term training adaptations, specifically gains in muscle strength and hypertrophy, which is just muscle size. The foundational paradox is this. Muscle growth is an adaptive response to stress. To get stronger, you first have to cause damage.
And that damage triggers a necessary acute inflammatory response.
A necessary one. And that necessary response is what CWI is specifically designed to kill off.
Right.
The cold interferes with the body's natural inflammation-mediated repair pathways that are absolutely essential for muscle growth. When you train intensely, that inflammatory response, it attracts immune cells, neutrophils, and macrophages to the damaged site.
The cleanup crews.
They're the cleanup crews, but they also release essential growth factors. And even more importantly, inflammation is key for activating what are called satellite cells.
Satellite cells. Those are basically muscle stem cells, right? Waiting in the wings.
That's a perfect way to describe them. They are dormant cells just waiting on the periphery of the muscle fiber. When muscle damage occurs, the inflammatory signals activate these satellite cells. They then proliferate and fuse with the existing damaged muscle fibers.
And that's what makes the muscle bigger and stronger.
They contribute new nuclei and, crucially, they facilitate hypertrophy, the increase in muscle size and strength. So by suppressing inflammation with cold, you are essentially blunting the signal that tells the satellite cells to wake up and get to work.
That is a staggering molecular trade-off. It's not just a minor delay we're talking about. We are talking about actively interfering with the fundamental biological switch for strength gain. And this is also linked to the famous mTOR pathway, isn't it?
Absolutely. The same inflammation and mechanical stress signals that activate satellite cells also activate these key anabolic signaling pathways, most notably the mammalian target of rapamycin, or mTOR pathway.
And mTOR is the master regulator.
It's the master regulator for protein synthesis. It is the build muscle now command center in the cell. And research suggests that CWI, through its vasoconstrictive and metabolic slowing effects, can significantly suppress this essential signaling pathway right after you exercise.
Okay, so let me get this straight. If I step out of a heavy lifting session and my primary goal is to maximize my bulk and strength,
Right.
and I immediately jump into a 55-degree bath for 15 minutes, I am stopping the activation of my muscle stem cells and I'm turning down the volume on the key molecular signal, mTOR, that tells my body to start building new protein.
That is the compelling conclusion drawn from the studies that focus on strength and hypertrophy over time. You are, in essence, halting the body's foundational communication about repair and growth.
Which makes CWI an anti-adaptation tool,
Exactly.
even though it's a phenomenal immediate recovery tool.
It's the paradox in a nutshell.
This fundamentally changes the whole conversation around CWI for certain athletes, bodybuilders, powerlifters, or like a football lineman who's focused on maximizing bulk in the offseason.
It has to.
It's not a panacea, it's a strategic risk.
Mm.
And the limitations, they extend beyond just strength gains, right?
Yeah.
What other caveats did the sources reveal?
A major one is the inconsistency of the systemic effects. So the evidence regarding CWI's ability to significantly reduce systemic inflammation biomarkers like C-reactive protein, CRP, or interleukin-6.
The stuff floating around in your blood.
Exactly. That evidence is often limited and really inconsistent across studies. So while it works locally to reduce swelling and perceived pain, the sources suggest that the widespread systemic anti-inflammatory benefits that are often claimed.
They aren't really backed by the research.
Not reliably, no.
So it's great for managing the swelling in my quad, but it might not be doing much for the inflammation markers floating throughout my entire cardiovascular system.
Precisely. The effects are often localized or perceived rather than, reliably universal or deep-seated. And furthermore, the outcomes are highly dependent on the individual's fitness level and the type of exercise they performed.
And here's where this unexpected wrinkle comes in. You mentioned that early studies often failed to show clear benefits for untrained individuals experiencing DOMS.
That's a fascinating finding, and it really challenges the common narrative. If you are a weekend warrior, you're new to a routine, and you are just excruciatingly sore, the kind of soreness that lasts for days, the ice bath might offer only a limited physiological benefit compared to a trained athlete.
Why is that?
The difference in the physiological response between trained and untrained muscle tissue suggests that CWI interacts differently with a muscle that has already undergone repeated cycles of damage and repair versus a muscle encountering that stimulus for the very first time.
So the trained body might just be more efficient at using the neurological dampening.
That's one theory. While the untrained body's fundamental inflammatory processes are still so dominant that they're less responsive to the cold intervention.
That makes the utility of CWI highly specialized. It's targeted not just by goal, but by your training status. And finally, we have to talk about the quality of the research itself. If CWI has been a staple for decades, why are we still kind of grappling with what the optimal protocols and safety guidelines are?
It's a great question. The sources confirm that the quality of a lot of the early data was, generally low. They often featured small sample sizes, heterogeneous protocols.
Meaning everyone was doing it differently.
Totally different, varying temperatures, durations, immersion depths, and really poor control groups.
So it was hard to draw firm conclusions.
Very. And it means that optimal protocols and long-term safety remain somewhat unclear, which just reinforces the need to strictly adhere to the specific controlled protocols we mentioned, the 10 to 15 minutes at 11 to 15 degrees Celsius that have emerged from the highest quality recent trials.
So we can't trust the general historical practice. We have to follow the refined science.
We have to.
And this brings us back to that perfect analogy you used to summarize this entire section. Using CWI for every workout is like taking a painkiller to mask a dull ache when you really need to be listening to your body.
Exactly. The painkiller makes you feel better now, it allows you to keep moving, but it prevents your body from hearing the signals, the inflammation and soreness that it needs to grow stronger. You are masking a necessary biological process that drives adaptation.
And for the strength athlete, that immediate relief is tangible. But the long-term cost is a very serious concern.
It is, and it forces us to weigh CWI against other recovery options that don't carry the specific risk.
Okay, so given that we've now identified CWI as this, high reward but also high risk tool that's completely dependent on your specific training goals.
Immediate performance versus long-term adaptation.
Right. It's critical to put it into the larger athletic toolkit. It's not the only way to recover, obviously. We need to see where it stacks up against some of the competing strategies, especially the ones that don't have that long-term adaptation risk.
Understanding this hierarchy of recovery strategies is really key to intelligent programming. So let's start with the clearest comparison first. CWI versus simply resting.
That seems like an obvious win for CWI, right? Just sitting there versus doing something.
It is the one undisputed win, yes. CWI is definitively superior to passive rest, or no treatment for reducing soreness and improving that perceived recovery.
Right, you mentioned the 96-hour window.
Exactly. That research showed CWI reduced soreness for up to 96 hours post-exercise compared to just sitting on the couch. So if the goal is immediate pain mitigation, The cold intervention is absolutely better than doing nothing.
Okay, easy enough. Now, for the really tricky comparison, the one that really challenges the CWI narrative, cold water immersion versus active recovery.
Mhm.
And active recovery is defined broadly as what? Low-intensity exercise like a light jog, cool-down cycling, gentle swimming, that kind of thing.
Exactly. And this is where it gets really interesting and requires some serious consideration from you if you're listening. High-quality research shows no significant differences between CWI and active recovery when it comes to cellular stress responses and inflammation levels after resistance training.
Wait, hang on. So if the primary goal is managing inflammation and cellular stress to get back to training faster, you're saying a light walk achieves similar physiological results as plunging myself into 55-degree water without the severe discomfort.
That's the implication.
That's a huge implication.
It is. CWI is not necessarily superior to active recovery in managing the body's physiological response to exercise. And the mechanism of active recovery is fundamentally different, and it avoids the paradox.
How does it work then?
Active recovery works by maintaining light circulation, which assists in gently flushing out metabolic waste products like lactate and hydrogen ions, and promoting better lymphatic drainage. But crucially, it does this without interfering with the metabolic and inflammatory signaling pathways that are needed for growth.
That provides a massive tactical advantage for a strength-focused athlete.
It really does.
If I can achieve similar management of cellular stress and reduce my perceived soreness with a 10-minute cool-down walk or a light cycle, an active recovery protocol that doesn't carry the risk of blunting my strength adaptations, why would I ever choose CWI during a dedicated strength phase?
The choice comes down entirely to goal prioritization, if immediate, powerful pain suppression and perceived recovery are paramount.
So a tournament setting.
A tournament, a high-stakes, quick turnaround competition with multiple events in a short period. In that case, CWI might be the better choice purely because of that powerful neurological dampening effect. It overrides the pain signal more aggressively.
But if you are in a 6-month off-season phase and you're focused purely on maximizing muscle size and strength, the sources suggest active recovery is objectively the safer bet.
Absolutely. The sources specifically note that CWI carries a distinct evidenced risk of blunting long-term adaptation. That's a risk that's not associated with light movement or simple massage. The acute inflammation needed to trigger adaptation is preserved by active recovery while still facilitating waste removal and promoting a sense of well-being.
Okay, let's look at the other popular options. What about CWI versus modalities like compression gear or massage?
The evidence here is a bit murkier, but importantly, the sources note that CWI's superiority over methods like specialized massage and compression remains less clear.
So no clear winner.
No. Just like with active recovery, the available high-quality data doesn't conclusively show that the cold plunge is inherently better at facilitating overall recovery than these alternatives.
Why do massage and compression work similarly in the recovery phase? What are they doing?
Both methods focus primarily on enhancing local blood flow after that initial period of muscle damage and promoting lymphatic drainage. So compression gear, for instance, it uses gradient pressure to physically aid venous return and limit fluid accumulation.
So it's achieving similar edema reduction to the vasoconstriction of CWI, but it's doing it mechanically instead of thermally.
Exactly. And massage works by physically manipulating the tissue, which improves circulation and can potentially reduce myofascial tension. But neither of these modalities typically interferes with those core metabolic and inflammatory pathways required for long-term growth.
So the strategic takeaway for the listener has to be that CWI should be viewed as one highly useful but also highly specific tool among a whole range of options. And it has to be chosen based on the athlete's immediate goal versus their long-term adaptation goal.
And we can use one final analogy to clarify this strategic choice. Comparing CWI to active recovery is like choosing between two ways to cool a house quickly after, some intense activity.
Yeah.
CWI is like a high-powered, energy-intensive air conditioner or a big fan. It's immediate, it's noticeable, but it requires this sudden, drastic intervention, the cold shock, and it could potentially interfere with the underlying structure, by blunting adaptation.
And active recovery.
Active recovery is like opening the windows and just using a cross breeze. It achieves a similar, comfortable cooling effect through natural, gentle means flushing waste, gentle circulation, without affecting the building's ability to conduct future renovations.
Both are effective, but one carries a specific long-term consequence.
That's the choice.
That tremendous clarity really allows the listener to move from just blind adherence to traditional practice
Mm.
toward intelligent, goal-specific recovery programming.
So, to synthesize the key takeaways from this deep dive into cold water immersion,
Mhm.
CWI is a high impact, very targeted tool. If you are an athlete in a high intensity sport, or you're currently in a heavy competition phase where immediate soreness mitigation and performance maintenance are essential,
It's a powerful ally.
it is a powerful ally. But you have to strictly adhere to the optimal research backed protocol. That's 10 to 15 minutes in water between 11 and 15 degrees Celsius, which is 52 to 59 Fahrenheit.
Applied immediately post-exercise.
Immediately. Deviation from this risks diminishing returns and, more importantly, increasing the likelihood of that negative adaptation interference.
And the essential nuance here is that the usefulness of CWI depends heavily on your primary training objectives. If the goal is immediate performance maintenance, to numb the pain and make sure you're functional for tomorrow's demanding schedule, then use CWI strategically.
Mm-hmm.
But if the goal is maximizing long-term strength and muscle size over the course of a year, CWI should probably be used sparingly, if at all, because it interferes with the very biological process, that inflammation and satellite cell activation, that drives foundational growth.
CWI is a superb fire extinguisher for immediate physiological chaos, but it is not the structural renovation crew you need for long-term strength and muscle building.
Choose your tool based on the job.
That's it.
And since we've established that CWI is often matched by active recovery in managing cellular stress and inflammation, yet CWI is the one that carries the specific risk of blunting those growth pathways, we want to leave you with a final thought to mull over.
Okay.
If your long-term goal is adaptation maximization, consider this. What signal is your body sending you when you feel that powerful urge to suppress those natural inflammation signals with cold? And what gentler alternative recovery modality could you use to improve immediate performance without interfering with the body's fundamental need to communicate, adapt, and grow stronger over the next year?
Think critically about the purpose of your recovery. Are you just managing a symptom to facilitate immediate play, or are you prioritizing adaptation maximization? The answer to that question should guide you to the right tool in your recovery arsenal.
That's the end of this deep dive. Thank you for joining us. We hope you feel well informed and ready to apply this knowledge to your